So welcome to the session 3 of the Waters webinar week, focusing on innovations and applications for the clinical workflow. I'm Godo Bosch, and I will be your host. Before we get into the presentation, I'd like to cover a few practical details. Some of you may be already familiar with this setup, but I will still cover it. At the bottom of your screen, we have attached some material related to the talk today, which can be downloaded or consulted. Some are documents and some others are web pages. On the top left is a very important feature. It's the Q&A box. You can type in your questions as they come during the presentation, and we'll do our best efforts to answer all of them at the end of the presentation. And on the right is another very important thing, a very short survey for, 3 questions that we'd like you to answer and give us some feedback so that we can improve further for future events like these. So for today, we have 2 presenters. I will start with Isha Chowdhury, who is a Senior Global Product Manager in the Clinical Business Unit, which has been created 18 months ago by Waters Corporation. She joined Waters 3 years ago and has recently supported the development and launch of the Mastrac immunosuppressant sets, as well as the Mastrac steroid serum sets. Starting the presentation will be Dominic Foley, who is a senior scientist working at Waters, Mass Spec headquarters in Wilmslow in the UK, and he's part as well of the Clinical Business Unit. He joined Waters 10 years ago and has specialized in the development of LC-MS MS clinical research applications with a particular focus on steroid hormone analysis as well as biomolecules. Their presentation title is Enabling Harmonization of Steroid Hormone LC-MS methods through use of Mastrac steroid serum sets. And without further ado, I pass it on to Dom and Isha.
Thank you, Godo. So thanks for joining today. This is the outline of what we plan to discuss today. I will firstly cover the importance of high-quality analytical methods in steroid measurements and how the perception of these methods have changed over the last 20 years. This will include emphasis on the value of LC-MS and the confidence in the results it can provide. Isha will then discuss the Waters workflow and the Mastrac sets and how these can benefit your laboratories. I will then follow this up with an LC-MS method for steroid hormone analysis using the Waters workflow, and that includes the use of the Mastrac sets RUO. And finally, Isha will then finish up the presentation with further resources and collateral. So, the importance of high-quality analytical methods in steroid measurement. High-quality analytical methods provide a number of benefits, including aiding the consistency of data interpretation, which can improve the identification of abnormal results. This can help minimize additional testing relating to poor performance of the method, saving time and money. This consistency can result in greater harmonization of data across different laboratories, improving the overall quality of cross-collaborative research. For steroids that exhibit diurnal and age-related changes, in addition to plasma protein binding, an analytical method that meets the measurement performance specifications can be critical. And as you can see on the right-hand side of the slide, a steroid such as testosterone falls into this category, and based on biological variation, and in this case taken from the EFL database, the desirable bias and precision specifications are around 6%, indicating the need for a high quality analytical method associated with this analysis. So there are challenges in steroid hormone measurement, and I thought I'd use testosterone to shine a spotlight upon this or these challenges. And these challenges have been fully recognised in the last 20 years. And in 2003, there was an editorial in Clinical Chemistry that asked whether widely adopted immunoassay techniques for testosterone analysis are better than the guess. And this was based on method comparisons between immunoassay platforms and mass spectrometry, and later corroborated by others. It demonstrated that testosterone immunoassay results from females were inaccurate and sometimes missed the target values by 200 to 500%. And these studies resulted in the generation of an Endocrine Society position statement on testosterone, stating that direct assays for testosterone should be avoided, and methods using extraction and chromatography Similar issues were highlighted across different steroid hormone methods, which led to the Endocrine Society and Urology Society guidelines highlighting issues of using immunoassays for steroids and indicating MS methods are the preferable measurement. Then in 2013, a positioning statement was released by the Journal of Clinical Endocrinology and Metabolism, somewhat controversial at the time, which recognized that for high impact steroid research, the era of immunoassays was coming to a close, and the acceptance guidelines on manuscripts was going to reflect this from January 2015. However, this recommendation was later suspended pending further review because of the wider ranging impacts this would have on the clinical research. However, based on the growing use of LC-MS in clinical laboratories in 2014, CLSI released an improved guideline on the use of and the implementation of LC-MS methods in clinical labs. And within that, they state that LC-MS assays are superior with regard to selectivity due to combination of the LC separation and mass selection. And the power and value of LC-MS is demonstrated in this slide, where we have a series of different steroid isomers that could interfere with each other during immunoassay measurement, and even just mass spectrometry alone, where we have 11-deoxycortisol, 21-deoxycortisol, corticosterol, all isomers of each other, 17-hydroxyprogesterone, 11-deoxycorticosterone are isomers, as well as testosterone and epitestosterone. And what we see here is that we can separate them out and be detected using LC-MS. So the orthogonality of the chromatography with the MRM mass spectrometry is a particular powerful tool that enhances the method precision and accuracy for these steroids, providing greater confidence in the results we obtain. So one key difference in the use of LC-MS methods for steroid analysis is that they are often based on laboratory developed tests. And these are validated to regulatory guidelines, such as CLSI, FDA, and EMEA method validation guidelines. And this means that method harmonization and the quality of laboratory materials used becomes more important. And as part of lab quality management systems are increasing demands on demonstrating the quality of clinical methods using LDTs. One aspect of this is the growing need for metrological traceable calibration materials to replace in-house prepared materials to aid compliance with ISO 15189. And these are based on requirements for quality and competence in medical laboratories. This metrological traceability is a process that related measurement values to a reference standard and is a tool to ensure more accurate results. So with that in mind, this is just something that we thought we'd ask in terms of a quick poll. So if possible, in the next 20 or 30 seconds, I just want to get some quick feedback on from the audience on a question around, is metrological traceability for your cows and QCs important to you? And it's either yes or no in this instance. So we just want a quick idea of, is it a high priority in your laboratory in regards to the production of calibration and QC materials? So I'll just give you another 5 or 10 seconds on that, and then hopefully we do get some poll results from the attendees. And then what the intention is then is to pass over to Isha, who will take you through some of the benefits of the new MassTrack sets for steroid analysis. And we have 100%, so yes, it's important. So over to you, Isha.
Thanks, Tom. And thank you so much for our audience for participating in that poll. So to meet your laboratory's need to develop these high quality analytical methods for steroid measurements, Waters offers a suite of products for the end-to-end endocrinology workflow. The products included in this workflow help support a wide range of endocrinology applications, such as steroids, proteins and peptides, amines, and vitamins. So if you look at the overall workflow, starting from sample prep, we offer AndroPlus robots that execute sample prep steps with a high level of reproducibility and full experimental traceability. Additionally, for sample prep, we offer precision consumables and standards that are produced with low lot-to-lot variability and tested rigorously in-house. Our MassTrack standards, such as calibrators and QCs, are metrologically traceable to both reference material as well as reference measurement procedures and help with steroid method standardization. For LC-MS, our Acuity I-Class Plus LC systems, coupled with either the Xevo TQ-S Micro or the Xevo TQ Absolute mass spectrometers, help support robust quantification of a broad range of endocrinology analytes, especially those that are found at the very low end of the concentration range in the human body. And then finally, on the back end, our data acquisition and reporting softwares, such as MassLynx and TargetLynx, offer a range of data processing functionalities with the ability to bidirectionally communicate with labs' LIMS systems as well. So I wanted to take a deep dive into the MassTrack steroid serum sets, which form a critical component in the steroid LC-MS workflow. So here's an overview of the MassTrack steroid serum sets family. A set will contain at least a CAL and QC, and in some instances contains additional products like the internal standards and optimization mixes that are critical to method development as well. There are 3 different steroid sets that we offer. Set 1 includes CALs, QCs, IS, and optimization mix, and covers a panel of 12 different steroid hormones indicated on the bottom left-hand side of the slide. This panel was designed keeping in mind the medium to low throughput labs that typically get requests to test multiple steroids in one sample and have less pressure on meeting short turnaround time expectations. Sets 2 and 3 contain CALs and QCs. Set 2 includes a panel of 4 steroid hormones. Set 3 includes a panel of 5. And these smaller panels are more suitable to your high throughput labs that typically get requests to test fewer number of steroid analytes per sample and have higher expectations to meet short turnaround times. All of the CAL, QC, IS and optimization sets can be ordered individually, and some of the components like the IS and OptiMixes are compatible across all 3 pairs of CAL and QC sets. All 3 sets are available in RUO format currently, with the CAL and QC set 1 also available in the IVDD format in Europe. We've launched these RUO sets 1, 2, and 3 in June this year, and we're very pleased to announce the upcoming launch of the IVDR-approved sets 2 and 3 that should become orderable in the next 2 to 3 months. Set 1, IVDR, will then soon follow up with a launch in Q2 next year. Here are some high-level features of the sets. Concentration ranges for all of the analytes included in the 3 calibrator sets are included on the table on the left. And as you sort of hover down the table, right off the bat, you can see that there are wide concentration ranges in place for all analytes included in these CALs to support various analytical and workflow needs. In terms of configuration for the CALs, we offer at least 6 different levels, including the blank. The QCs are offered in either a 3-level or a 4-level format. The CALs, QCs, optimization mix, and the IS, all of them contain lyophilized steroid compounds with a target recon volume of 2 mils for the CALs, QCs, and optimization mix, while the IS is offered with a target recon volume of 25 mils. Additionally, these products have long in-use stability, so we report up to 3 months at -10 degrees Celsius for all of the 4 components, and a stability at 1 month at 2 to 8 degrees Celsius for CALs and QCs. And finally, all of the CALs and QCs are prepared from different CRM sources, and the values are assigned and traceable to either certified reference material or reference measurement procedures like Ghent or RFB. So all of the features that I just spoke about in the earlier slide were meant to confer 4 main benefits to your lab. So with using these ready-to-use steroid serum sets, you can save time and resources that would have otherwise been spent on producing these in-house. And with 3x longer in-use stability compared to some of the more competitor products on the market, we allow the consumption of this product for a long period of time as well. Secondly, you can comply with ISO 15189 as well as CLIA C62A, some of the guidelines that Dom talked about earlier in the slide, because these CALs and QCs are metrologically traceable to not just CRM, but to reference measurement procedures for certain analytes. And we take a lot of effort in making sure that our CALs and QCs are sourced from 2 different CRM sources. Thirdly, the wide concentration ranges for our CALs and QCs really help support a wide range of analytical and workflow needs that you may have. And then lastly, you can observe high performance in peer lab comparisons like EQA schemes that you may participate in by using these sets that are manufactured with high lot-to-lot consistency and tested in-house using those select EQA materials as well. So I wanted to double click on that final benefit. Apologies, let me just go back. Not quite sure why the photo is showing, but so we go through in-house testing, very rigorous testing schedules for all of the calibrator and QC sets that we make in-house. The testing is performed using a combination of EQA materials as well as in-house QC panels, and the mean lot-to-lot deviations for all of the analytes included in a set are then examined against EQA ALTM. If the plot on the right showed fine, you would have seen some sample data for steroid set 1 calibrators with those mean deviations plotted for all 12 analytes. And for all 12 analytes for those 3 different lots prepared, we've shown deviations of less than 9.3% against EQA ALTM. So using the MassTrack steroid sets enables your lab to maintain those harmonization performance over time using different manufactured lots of CALs and QCs. I'll hand it over to Dom.
Okay, thank you, Isha. So Isha has described some of the benefits of the MassTrack sets RUO. So I thought what I'll do now is just take you through the application of those sets with an in-house developed LCMS method for some corticosteroids and androgens. So this is, again, is a Waters workflow slide for LCMS of steroid hormone analysis. And what I thought I'll do is just pull out some of those products, consumables, and informatics platforms to demonstrate what we're actually using with this analysis. So we're using Oasis, SPE, consumables. We've got the MassTrack sets, the columns, the Acuity UPLC HSS column, the Acuity UPLC iClass Plus system linked with the Xevo TQS Micro, and we're using the MassLynx and TargetLynx informatics platforms. And before I proceed to the methodology we applied as a water solution, I thought I'd just ask a quick question around sample preparation. So on my travels, I know different customers use different sample preparation techniques for steroid analysis. So I thought I just want to ask the audience, what is the predominant sample preparation technique you use for steroid analysis? Do you use solid phase extraction, supported liquid extraction, liquid extraction, or protein precipitation as the main technique in your lab? I just thought I'll give you another 5 or 10 seconds to answer that before I move on to the next slide. Okay, so I'll move on to the next slide now just to see the results. And we have a combination of two, so solid phase extraction, 50% from the people who've answered, and then 50% from the attendees for protein precipitation. So that's interesting, really. So in regards to our workflow, which we'll see on the next slide, so this is the water system solution. As you can see in the sample prep consumables, we are using the Oasis SPE Prime HLB microelution plate. So we are using solid phase extraction for this water solution. And that is in combination with the Mastrax sets for that analysis. And we're able to automate this on the Hamilton style liquid handling robot. And there are other automation platforms available to do this, but our focus was on Hamilton in this instance. And we're able to adopt that sample preparation, to perform separation on the Acuity UPLC I-Class Plus FL system, with separation on the HSS T3 column with T3 Vanguard, and detection on the TQS micro mass spectrometer. The runtime for this is 5.5 minutes injection to injection. Just some more details around the actual sample preparation for this method. So we thaw mix the samples and centrifuge prior to use. We use 100 microliters of sample for the analysis. We add internal standard, and then we precipitate briefly with addition of methanol to disrupt the protein binding associated with steroids in serum. We dilute that with water. This helps with the binding of the analytes to the solid phase extraction material. And we centrifuge that to create a pellet at the bottom of the plate or microcentrifuge tube. We take that supernatant and add that to the plate after we've equilibrated and conditioned the plate. So we load that supernatant slowly onto the plate to ensure that it binds well to the chemistry. We wash the wells with high pH and low pH, so 0.1% ammonia in 35% methanol, followed by 0.1% formic acid in 35% methanol. So this is just to help remove any of those potential unknown interferences you may get from sample to sample. And then we elute the analytes with acetonitrile and methanol from the plate, so we only use 30 microliters. And then we subsequently dilute that with 70 microliters of water. So this allows us to inject the eluate effectively directly from the extraction onto the LCMS system. And some more details around the Acuity UPLC I-Class Plus FL system setup. So we're using ammonium acetate, 0.1% formic acid in water and methanol for this method. So this, just before I move on, actually, this application note is available. So some of the resources will be highlighted at the end, and also within the webinar itself, there are also links to some of these resources. So we have a weak wash of 40% methanol, strong wash of methanol, and it's a fairly basic gradient setup from 1 to 3.5 minutes. It had been increased to 20% B over that time frame. And as I said, it's 5.5 minutes injection to injection. And some details around the TQS micro setup. So we're looking at positive ion mode and also actually negative ion mode. So that's actually not necessarily fully correct there. So DHA sulfate is in negative ion mode. Capillary voltage of 1 kilovolt, 150 degrees source temperature, 600 degrees desolvation temperature. And just moving to the bottom, unit mass resolution on the MS1. And also, we just narrow the resolution slightly in MS2. Sometimes we do this just to help improve the selectivity of the assay to a certain degree at the lower end of the concentration range. This can sometimes help reduce some of the background noise associated with this type of analysis, and then can improve your signal to noise. And the MRM conditions for this analysis, we have obviously the sets 2 and sets 3. There are different analytes within that sets, but also the sets do share some analytes like androstenedione and 17-OHP. I'm not going to talk all the way through these transitions, but just to highlight, we are looking at, as I said previously, a negative ion compound in DHA sulfate, and the rest are in positive ion mode. And each has an internal standard, either deuterated or isotopically labeled 13C3 internal standard. Here we have some chromatographic separation. I don't think the picture there is a full resolution, but you can make out that separation between some of those critical steroid isomers that are previously discussed on the HSST3 column. So we have the 11 and 21 deoxycortisol and corticosterone towards the top of the chromatogram, the 17-OHP and 21-OHP towards the bottom of the chromatogram, and also testosterone and epitestosterone. And also there's some high-level performance characteristics around analytical sensitivity and linearity. So what I've done here is just highlighted what we achieve for analytical sensitivity of the C1 calibrator in MassTrax sets 2 and 3 that provide a signal to noise greater than 10 to 1. So as you can see, signal to noise across both sets using this method on a TQS micro is more than enough in terms of performance. And I've also highlighted one of the calibration lines for, in this case, testosterone. And this spans over 3 orders of dynamic range. So it's demonstrating that we do have linearity across that range. And that's the steroid within both sets that has the widest dynamic range across the sets. Some performance characteristics associated with precision. So this was determined by extracting and quantifying replicates of a 4-level QC material over a 4-day period. And we actually had 48 replicates across each set. And repeatability was assessed by analysing 4 replicates at each QC level. And what this demonstrates is actually we've got really good precision for total precision and repeatability in both sets using this method. So set 2, we're seeing less than or equal 6.9%. In set 3, it's slightly more elevated at 9.9%, but still within what you would expect in terms of a good method. There is slightly high deviations for the 21-deoxycortisol. This is probably one of the more challenging analytes associated with this analysis, but as I said, it's still within 10%. Moving on to some performance characteristics. So we looked at agreement to some EQA material and also in-house panels. So there was only EQA material available for testosterone, androstenedione, 17-OHP, DHAS, and cortisone. Unfortunately, at this moment in time, as far as I'm aware, there's no EQA material for 11-deoxycortisol and 21-deoxycortisol. So we used some in-house panels, which were independently gravimetrically prepared. to assess the accuracy of these compounds. And the data was obtained over a 4-day period and compared to the mass spectrometry mean for each EQA sample, in the case of the ones that we did have EQAs for, and the mean percent difference from the target was tabulated. And the mean bias for these samples was within 5% across the range. So it demonstrates that we've actually got good metrological traceability and a good enough routine measurement procedure in place using this in-house developed method. And Isha did cover some of the benefits of the MassTrack sets workflow, but what I thought is just highlight the benefits of the overall workflow we're employing for this RUO analysis. So we're looking at savings of up to 3 months of skilled labour time spent on in-house production using the MassTrack sets. And these sets can be used in up to 20 sample batches with each set. So they can be used for, depending on your throughput, you could end up using like one set for every 1 or 2 months of analysis. The overall cost per sample for the calibrator is around 30 cents or 20 pence, depending on where you're coming from around the world. It's up to 3 hours to first sample result. So that's taken into account. You've already prepared the sets. You perform the analysis of a typical batch between 48 to 96 samples, which takes about 2 hours. And then the LC-MS analysis for the calibrators, followed by the first sample, takes about 3 hours overall. When you incorporate both the sample preparation and the analysis time. There is 1 month in use stability, which Isha has already highlighted with the Skeleton QCs. And we've demonstrated that when we do analyse these, the accuracy compared to EQAs is within 10%. We have the benefits of the MassLynx LIMS interface as well at the back end, where we've got exchange of data flow between the MassLynx and any LIMS systems you have in place. So that improves your efficiency in the lab. And also you have the injection to injection time as well, which gives us 5.5 minutes over the course of separation of 7 steroid hormones. And very briefly, I just want to cover some competitive comparisons. So this is based on obtaining some materials from different vendors. These are their calibration materials. So we compared EQA, LC-MS method bias across the vendors using this in-house clinical research method. And as you can see, both vendor A and vendor B do show quite large increases in variation from that target concentration. And what this shows is the MassTrack serum sets, steroid serum sets, were shown to have the lowest level of deviation from those target values. So in summary, just like to highlight that the MassTrack steroid serum calibrator and QC sets contain metrological traceable calibrators, and that does aid in compliance to 15189. Significant time savings and resource can be made by using these pre-made materials, and it's demonstrated that these materials are reproducible and accurate across manufacturing lots and do cover the relevant ranges for each steroid hormone that you may be interested in. And using an in-house developed method, we've demonstrated excellent performance of the MassTrack steroid serum sets using the Waters LC-MS workflow solution. So before we finish up today, I'd just like to pass back to Isha just to discuss some additional resources.
Thanks, Tom. So I wanted to leave the audience with some tools and resources that you can leverage to find more information about the product. I've hyperlinked the landing page for the Mastrac steroid RUO sets family over here. Please feel free, it can easily be found on the Waters website as well. This landing page serves as your one-stop shop solution to find out everything you need about the product. So on the product webpage itself, we have links to the app notes, the instructions for use. We also have the functionality to place the order online directly for these products. And then we also have an ordering guide as well to help you sort through all of the different SKUs that we offer. And then finally, I wanted to make you all aware that we have a global end of promotion ongoing for these sets. This is for web orders only. The discount code is CON15, and the different sort of rates of discounts applied dependent on the units that you purchase. All of the sets are included in this promotion, so the steroids and the immunosets. This promotion is ongoing till the end of Jan, so please feel free to utilize this to stock up on your sets supplies before the end of the year. And with that, I'd like to finish off our presentation. Thank you so much to all of our scientific collaborators who have helped provide their feedback all throughout the development for process for this product that has really helped in designing the product as best as possible. And thank you so much for our audience for listening in today. All of the information is hyperlinked into the presentation. And if you have any more questions, please feel free to visit our website, or you can get in touch with your local Waters representative. Thank you.
Thank you for the presentation. Now it's Q&A time. So let's see what came in. So we had a few questions. Probably the first one that I guess would be more for Isha. Are there any plans for Estrone and Estradiol to be added in the sets?
There are short-term plans to add the estrogens and the aldosterone into our sets, but we have yet to sort of put down a firm launch date on the ground. We will reach back out to collaborators such as yourself, Laura, to help make sure that we've designed a concentration ranges that are suitable for your lab, and we'll send out routine notifications as we get closer to the launch of those products. But what we anticipate is sort of augmenting our existing sets with those additional analytes.
Very good. So we have another question, probably for Dom or maybe Isha. How did you assess the accuracy? Did you spike the analytes in the matrix at different concentrations? Did you purify the plasma samples where you have spiked the analytes through your purification method presented here? So 2 questions in one, or 3.
I can perhaps try and answer that one. So a lot of the accuracy assessments are based on the external quality assurance programs. So we have the different steroid hormone programs that we choose the UK NEQUAS scheme, but there are others available, looking at effectively agreement to the mass spectrometry methods which is seen as the gold standard in this instance. So effectively we get hold of those samples and we measure them using the in-house developed method. So we extract the samples, so the serum samples, we extract those alongside our calibrators and QC materials, which are metrologically traceable. And that, in theory, will provide us with a good assessment of how our method is performing in respect to those mass spectrometry measured samples on the EQA scheme. So we take that mean measurement from the EQA scheme and compare to what the calculated concentration is using our methodology. I believe that is maybe the correct answer in regards to the question, but if you do want to follow up that, then feel free.
Yeah, definitely. I mean, if there are further questions, well, first of all, you can still type them into the Q&A box, or even ask us after we close this session if you have additional questions coming in. We have another one here. It's about, well, how we manage the different orders of magnitude of the concentrations between the steroids analyzed in a single panel, example HEAS is 100-fold higher than testosterone. So question is, yeah, how do we do without swamping the detector or losing some analytes in the analysis?
Yeah, so I can answer that one as well, Gordo. So, yeah, DHA sulfate is perhaps it's easy and difficult to analyze at the same time. It's that abundant that you can detect it, but then because it's so abundant, you can sometimes get issues around detector saturation, peak broadening, things like that. So we are able to balance that in the analysis. Typically, DHA sulfate doesn't recover as well through the solid phase extraction compared to other steroids. So you do get some loss in recovery as a result of that, particularly with our method. So that does actually help in regards to that overall problem that you're describing. So we are able to offset some of that as well with manipulation of the detector conditions we have in the mass spectrometer. So we can almost reduce the sensitivity we have for, or even almost flatten the sensitivity we get from the mass spec to reduce that saturation effect if need be. So the things you can do in order to address that particular problem. So typically you want to reduce the sensitivity of the DHA sulfate and obviously improve the sensitivity for the others, such as testosterone.
Okay, thank you. We have two more. What automation is the steroid panel method compatible with?
Sorry, what was that, Gordo? Can you repeat that?
Yeah, what automation, well, how can we automate, or what automation is available for the steroid panels?
Yeah. So as I said in the presentation, we have this automated on the Hamilton Star, but effectively this is transferable across different automation platforms. We previously had this automated on the Tecan Freedom Evo 100 system, but since then we've gradually moved over to the Star to perform our automation methods. Theoretically, Andrew Plus pipetting robot could do this. Any sort of platform could do this. The method is fairly compatible with different systems, I'd say. It's a fairly routine precipitation and SPE method. So I don't envisage people having too many problems if they chose to adopt it on their automation platform.
Okay, yeah, I mean, fair. And last one, so what mass spectrometers are most suited for the analysis of the mass track set, so for the steroids that you described? I mean, here you have the TQS micro. I mean, well, what else would you consider?
Yeah, so we typically advise the TQS micro for most of our steroid hormone methods. But it would also work on a TQXS, Evo TQXS, or a Evo TQ Absolute. So they have the wider dynamic range detector, which can help compensate for the increase in sensitivity you do observe on those systems, because you get that extra order of dynamic range when you do move to those. So I'd say those are the systems you'd be looking at to run these. I wouldn't necessarily advise the use of a Evo TQD for these, because some of them are a bit more challenging and wouldn't necessarily be compatible, particularly with the mass track sets RUO for this analysis. So it's certainly Evo TQS micro as maybe a go-to, and then Evo TQXS or an Absolute as the next option.
Okay. Thank you. Thanks very much. Yeah, I'm not seeing any new questions coming in. Thanks again for the presentations. It was very insightful. I think as well, of course, the attendance for being here. We will have another session at the hour, but for that, we'll have to log out of this one and log in to the next one. So hopefully we'll see all of you in the next presentation. Thank you. Bye-bye.
Thank
Thank
you.
you.